My name is Dr. Kimberly Brown. I am a licensed naturopathic doctor working in San Jose, California. I'm again live from my garden where fall, we hope, has finally arrived after an awful heat wave. So tonight I'm going to be talking about iron deficiency and perimenopause. Somebody who was watching 2 weeks ago had a question about iron and why it can be dangerous. You never want to take iron if you don't know that you need it, and the reason being is that iron will accumulate in the organs and it can be quite toxic. There's actually a condition called hemochromatosis. It's a genetic condition. It can often go undiagnosed for many years and lead to organ failure. So we have to be really careful with iron, and you never want to take it unless a doctor has advised you to do so. And when I prescribe iron to my patients, I always tell them we will be retesting your iron and something called ferritin, which is iron stored in your liver, because I don't want it to go too high. So I do watch that, and I even say, do not take iron for more than, well, it depends on the patient, so I'm not even going to say the time frame, but certainly want to do it with doctor supervision. So that's the reason not to take iron unless you've been told to. So why is iron important? Well, it's one of the most important minerals in the body. Calcium actually is probably the most important, but I imagine everybody has their favorite. Anyway, iron is used by the red blood cells in particular. So women in perimenopause who are having very heavy periods, periods can become much heavier in perimenopause, will lose more iron. I mentioned it 2 weeks ago because anybody with hypothyroidism tends to be more at risk for iron deficiency, and that is because your thyroid needs iron. We think possibly there's a higher demand for iron in hypothyroidism. There's also something called anemia of chronic disease. I know, it sounds really scary, but we don't know why it occurs. It's often associated with autoimmune diseases, and those people need more iron. And circling back around to hypothyroidism, a common cause of hypothyroidism is autoimmune. So for women in perimenopause who do not have anemia of chronic disease or hypothyroidism, but who are having heavy periods or frequent periods every month, they're losing a lot of iron every month, twice a month. I've even seen some perimenopausal women having 2-3 week periods, and it's a race to replenish their body with enough iron so that, and find a way of getting the periods to lighten, to stop, to get a regular cycle, because worst case scenario, they'll need a partial hysterectomy. There's a lot of steps in between that. So, and certainly I have seen some women post-hysterectomy who wish they'd spoken to me first. I don't know if I could have prevented their hysterectomy, but I will try to do that, absolutely, to prevent a surgery like that. And this might lead into the next talk in 2 weeks, but we do see that hysterectomies, even if they're partial hysterectomies later in perimenopause, sometimes mid-perimenopause, can trigger menopause. So often a good doctor will actually warn their patients of this. So anything else to say about iron deficiency? There are some scary causes to iron deficiency. We're thinking gastric bleed. That's something I always want to rule out with my patients. Less likely in a younger patient, but can happen from gastritis, stomach aches, reflux, where you're bleeding, you have a bleeding ulcer, or colon cancer. And we do know colon cancer is sadly occurring in much younger people these days. So there are tests for that. But oftentimes the most common cause are heavy frequent periods. Either, yeah, definitely in perimenopause, they're more common, but we see that in younger women as well. It goes undiagnosed. I've seen so many patients, they come to me saying, well, my doctor said I'm fine, I don't have anemia. And that's because that iron goes straight to your red blood cells. So symptoms of iron deficiency, they overlap with hypothyroidism, hair loss, fatigue, insomnia, heart palpitations, restless leg, weakness. Those are the most common that I see. Another cause, almost forgot this one, malabsorption of iron. So gastrointestinal issues can lead to iron deficiency plus other mineral deficiencies. So we need enough stomach acid, we need a functioning gut to absorb all the good vitamins and minerals from the food that we eat. And then poor diet. I no longer see children in my practice, but when I did find iron deficiency in some children. Just, you know, sometimes just not eating, no fault of their parents, but, you know, diet, picky eaters. That was the few children that I saw with it. That was their issue. They just didn't, they only like certain foods. So all you parents out there probably can relate. So I hope I answered that question. And as always, I love meeting you and look forward to speaking to you again in a couple of weeks. Until then, take care. Bye-bye.